Ketuki is there. Hi, Ketuki.
Hi, good to meet you again. We meet.
Yeah, same.
So good morning, namaste, and wish you all a very happy Health Day. Thank you for joining us for today's panel discussion. My name is Sugandha Nagar. I'm the National Communications Manager for Health and Governance at UNDP India, and I welcome you all to this expert chat where we would be discussing the importance of healthy ecosystems for a healthy mind. Let me begin by welcoming and introducing our esteemed panelists for today. I'm honored to welcome Dr. Anil Kumar, Deputy Director General with the Directorate General of Health Services, Ministry of Health and Family Welfare, Government of India. Dr. Kumar leads the National Mental Health Program and holds a wide experience of 34 years working as a public health specialist in India and abroad, leading several successful health campaigns, including the leprosy case detection campaign. Welcome, Dr. Kumar. Our second panelist for today is Dr. Jay Kumar. Dr. Jay Kumar is Associate Professor at NIMHANS, Bangalore, and he specializes on psychosocial support during disasters and rehabilitation. Welcome, Dr. Kumar. There is a slight change. Dr. Sekar, who was our panelist initially, had some last-minute exigencies, so Dr. Jay Kumar is attending the panel discussion on his behalf today.
Thank you.
I now welcome actor, model, and former Miss World, Miss Manashi Chiller. Miss Chiller brought back the glorious crown to the country after 17 long years and is an inspiration for today's women and youth. On several occasions, she has actively spoken up on menstrual hygiene and is also the face of Anemia Free Haryana. Her project Shakti provides free sanitary pads for rural women, whereas through her social media initiative, Limitless, she speaks to country's most inspiring women icons and shares their journeys. Welcome, Manashi. Our next panelist for today's discussion is Dr. Ketuki Ranade, Assistant Professor at the Center for Mental Health of Tata Institute of Social Sciences and the founding president of the Association of Psychiatric Social Work Professionals. Dr. Ranade has worked extensively to promote and preserve mental health and well-being of several vulnerable groups, including the LGBTI communities, and has authored various publications on similar themes. A very warm welcome to you, Dr. Ranade. Our next guest for today's panel discussion is Mr. Thakur Firwani, Global Head of She and Sustainability at the Dr. Reddy's Laboratories Limited. In his career of over 2 decades, Mr. Firwani has spearheaded some very impactful and novel initiative in some leading companies. He founded the initiative My Sustainability Index, My Safety Index, and My Health Index, which is now a leading benchmark. He has been conferred with the prestigious Rising Star of Safety by the National Safety Council of USA in 2013 and was also recognized as the ultimate innovator by Worldwide EHS Amazon in 2018. We are delighted to have you on this panel discussion today, Mr. Firwani. As we all know, friends, that climate change is likely to be the greatest threat to human health in this century, and yet it is commonly not thought of as a health issue very often. The depleting grains and the shrinking water bodies, the changing pattern of seasons, the weather cycle, these are not only adversely affecting our physical health, but also our mental well-being. Many of us are already experiencing some of these effects, and for vulnerable communities, it is much more. And we have all seen that how it was so pronounced during the times of this pandemic. So beginning with you, Dr. Anil Kumar, as we just said that the climate crisis is a real threat to our health and mental well-being, we all have also witnessed how COVID-19 caused immense mental trauma and stress to many. What are some of the measures that the government is taking up to address these issues in the short and long run?
Okay, thank you. First of all, I would like to talk about the COVID-19 scenario and what we can do more about it. General, action which we are planning to take at the Government of India level. First of all, we should have a good surveillance system. We already have a surveillance system in the form of the disease surveillance program, which we have, the integrated disease surveillance program. But probably in view of COVID-19 scenario, we need to further strengthen it. So disease surveillance, more information gathering, and based on that, better analysis and better, intervention based on that. And second is the better preparedness. Now, when we are talking about the better preparedness, it includes the socio-psycho, support, psychosocial support, which we need to give to the community. And we are developing guidelines for that. And those, these guidelines will be part of the our preparedness. So this is how we are moving forward. Now, during COVID-19, days, we know we needed to give support to the people, and that is why we brought the tele consultation in picture. So eSanjeevani is the platform through which we do the tele consultation to the people. So we strengthen this. As of now, 18 states we are doing that, and we plan to expand it to everywhere in the country. So that is one area which we are focusing. Now we need to educate people. So right now we have a system of educating people through newspaper advertisement or through television channel and all that. But probably we need to move forward. We need to provide IEC which is community based. Now Panchayat may have a very effective role, very useful role in this. So we may approach through Panchayat to educate their own community members. We were successful in many other programs like leprosy in doing that. But in mental health issues also, we probably need to do that, and we will expand it in that direction. Similarly, for mental health issues also, we will have to have a special disease surveillance system, the surveillance system, through which we gather information about the type of illnesses we are having throughout the country, which particular group is having this problem. And to link with this, we to have a database of resources available with us to counter that. And linking those things, we can provide the necessary intervention. We can link the information which we gather through our surveillance system to provide the resources. So this is how we want to move. And then we know we cannot reach everywhere. So we need to get the support of the community group. The community group can be in the form of the formal group, or it can be informal group. The formal group like Panchayat or other government machinery which is working at village level, at the community level, they can support us. But more important is the informal group, like we have Mahila Mandal, youth group. They can support us in providing that service, and that will also help in changing the environment towards the mentally people who are not mentally so good. So we need to involve all of them, and also with all this support system which we are going to develop at primary health care level through primary health center or community health center to give them support for specialized care at secondary tertiary level. We need to develop at that level also. So this is what government is planning to do. Thank you.
Thank you so much, Dr. Anil. I totally agree with you. In the past, we've seen that how IC and community engagement has helped reap us great results for all social welfare programs, and this is true here as well. So, Dr. Jay Kumar, my next question is to you as someone who works for an organization that leads in mental health. What have been some of your key observations on the relationship between climate change and mental health and well-being? Would you like to please tell us?
Thank you, Sunandana, and good morning to all my esteemed co-panelists from Bangalore, Nimans. Your question is very, very pertinent to the present context. We all know actually that we are sitting in a time bomb sort of a situation. The climate change is wreaking havoc on the health of people, not only the health and the mental health of the people. The adverse climate events, something which is, we can quickly put it actually like adverse, acute sort of a thing like floods and other things, and a long-term sort of effect on like global warming and drought and all those things, which has both direct and indirect impact on the mental health of the people. See, so far, what we have been talking about mental health and climate change is only under the paradigm of a health paradigm in only emergencies and disasters. We are not actually going beyond that when it comes to the mental health of the urban communities, mental health of the rural communities. See, by 2050, more than 68, almost 58 to 68 percentage of the population are going to live in an urban area. In another this 2 decades, we are going to add almost 2.5 billion people to the urban locality. So it is going to be a catastrophic sort of a thing. So you see actually that what is happening. Climate change means all our understanding is seeing people with a bucket, somebody is holding a child under the water, knee deep, neck deep water, or a polar bear, or actually the melting of glaciers. But nobody is talking about what is happening inside, behind these actually visual effects, the mental health. It is known, the mental health professionals around the globe stating that this is going to escalate into a major catastrophic sort of an issue, which will have a detrimental effect on not only on the mental health of the people, physical, social, economical, and various other aspects. So it is all intertwined in here. So it is just not direct and indirect. It is also actually multidimensional, and obviously this will lead people from well-being to ill-being. So the whole paradigm here is actually that this mental health will have an detrimental effect on people's functionality, people's efficiency, and directly it will have not only on the effect on the individual, family, and the community. At the larger level, it is at the global level, and your even at the GDP level and everything. So here actually the impact is holistic in nature. And so it's not going to untouch anyone, right from the government to the global, to the local, to the states, to the national, and everybody. And in this, there are actually certain marginal groups with vulnerabilities. They are going to actually have much more effect in their mental health is going to have much more impact than the other population, of course. And these people are actually already living in vulnerability, and these sort of a climate change events is going to escalate their mental health issues into some. So some of the major issues actually which we are actually identifying are anxiety, depression, even post-traumatic stress and disorders, and all over, across the globe. And but the point here is that the mental health professionals, the mental health intervention, the care, the capacity, and the resources are very minuscule, even to handle at the normal sort of situation. And event like a climate change, which is actually happening, which will increase. There are actually, we don't have actually that much of resources and wherewithal to handle these things. So there is actually an effect which is actually going to have a much more larger scale in the coming days. And I think actually it is just not the government, it is just not the stakeholders who are working in this area. It is actually the responsibility of each and every one of us actually to look into this important aspect of mental health.
Thank you, Dr. Jayakumar. So turning to you, Ms. Schiller, as a society, and as Dr. Jayakumar was also saying, when we imagine climate change, we imagine extremities. So for mental health also, we have not traditionally given due importance to mental health issues. The COVID-19 pandemic also showed us that how important is mental health and well-being, and it helped many of us cope with the stress of COVID better if our mental health was intact. So, and it also showed that how emerging threats can be dealt with, like pandemics and natural disasters, if we are emotionally and mentally healthy. So, what do you think? What role do celebrities and influencers and public figures play in creating more awareness around this issue?
Hello, everyone. So, Sugandha, I think starting with the fact that, celebrities, public figures, at the end of the day, we're all influencers. Whatever we say, there's a larger audience that listens. Our opinion, our voice resonates with a larger audience. So, yeah, that is in some way a certain power that we hold and a certain responsibility that we have. And the first and like the very primary thing that comes to my mind is creating awareness, talking about it. Just like what Dr. Jaykumar also mentioned, that during the pandemic we all talk about, or any disaster, we all talk about what's going outside, but no one has actually spoken about what's going on inside, what's going on in a person's mind. During the COVID-19 pandemic, there was a lockdown. We are social beings. We couldn't go to work. We couldn't have a normal routine like we normally did. We couldn't interact with people. So that did have a certain effect. And I feel that the good thing is that people have started talking about it. I think as public figures, it's very important to remove the stigma from, not being okay mentally. If you're doing well mentally, you can perform better. You feel better. Your relationships get better. So I think at the very core of everything that you do, your mental health is the most important. And of course, a lot of public figures have spoken about it. The good thing is that it is changing. There are support groups. There are people are finding it easier to speak about it. They have access to therapists and people who can help them overcome these issues. But it's not just celebrities, or it's not just influencers who should be talking about it. I think mental health is the responsibility of an entire society. And I think Dr. Jaykumar touched a little bit upon that as well. But it's great to see, as Dr. Anil Kumar mentioned, that the government at primary health care centers is making efforts to reach out to people and to give them support for their mental well-being. And I think that's really important to start at the primary level. And for us as a society to make sure that this is given as much importance as your physical well-being is given. And, I remember in 9th grade biology, I was in a CBSE school in NCRT, we used to read the definition of health, and it was not just your physical, but it was mental well-being was also mentioned over there. So I think the good thing is that celebrities, public figures, when we speak about it, it kind of makes an individual who is going through this in isolation feel like this is not just me. This is something that can happen to anyone. And I do have the option of seeking help. And I do have the option of talking about it.
Absolutely. Your point that when celebrities speak about it, a common person can also identify sometimes and feels that I am not alone. We are all in it and we can overcome this. That's absolutely valid. Thank you, Manashi. I would like to ask Dr. Ranade that we all have observed the impacts of climate change being felt more by the poor and the marginalized communities. Should mental health be an integral part of our strategies to ensure climate change resilience of communities, and how?
Okay, thanks for that question, Sugandha, and good morning to all of us here on the panel. I think to your question whether mental health should be integrated with efforts to sort of mitigate climate change effects, I mean, a simple answer would be yes. But how to do it is a sort of a bit more complex and layered question. When I'm saying simple answer would be yes, because I think we all see that every sort of policymaker, bureaucrat, researcher, anybody working in the area of public health will tell you that any kind of efforts that are made to improve people's quality of life will need to sort of come together. So in that sense, even when we look at the sustainable development goals, where climate change figures, mental health figures as well, it didn't earlier in the Millennium Development Goals, but now we know that mental health figures in a central way. And I think now for almost about half a decade we have whether we have woken up to the crisis of youth suicides in this country or celebrity suicides as well, or Pharma suicides, or a range of other mental health issues that have been sort of highlighted already. I think today we are seeing the significance of mental health alongside health and the connections between all of these. So if we look at just the sustainable development goals, whether it is poverty, whether it is gender equality, whether it is climate change, the need to integrate all of these together with each other, because it is actually finally the person who's affected is the individual, right? I mean, who's being affected as a poor person, who's been affected as a woman, who's been affected as a rural woman, as a woman from a minority community, as a marginalized person whose health is affected, mental health is affected. So yes, so the importance of conversions and integration of mental health in all of these efforts is absolutely essential. Having said that, before I jump into whether there are possibilities and how does one do it, again, one simple thing is to say that at our planning level and our implementation level, and also at the level of knowledge and research, how do we bring about this integration? So you will notice that climate change and its connection with mental health, and Dr. Jay sort of elaborated quite a bit on the direct and indirect effects. But I think in many ways this is an under-researched, although rapidly growing area of work. So people are able to think and see that there is direct, indirect, there is of course the immediate and long term as well. So when we think of climate change, there are of course some stat images that come to mind, as was mentioned earlier. But we are also thinking in terms of short term, long term, and I think what was called as multi-dimensional effect of climate change on health and mental health. So I mean, I just want to point to the fact that we need more research, we need to know more. When we are talking about integration, the first step would be to formulate the issue, formulate the problem. So we need to understand, how does climate change impact mental health. I think there is increasingly, so for example, I read about something called as eco-anxieties, which is something people are talking about. Now people are talking about something called as climate grief. And the long-term impact that is going to happen out of even within the emergency disaster paradigm that Dr. Jay Kumar was referring to. So there is some work happening here, and I think it's an emerging field. But I just want to point, one is that we need to create better knowledge, better research methodologies to unpacking these impacts. In doing so, we must do it in a participatory way. So when we are saying that the poor, the marginalized communities in the world, and specifically in India, are going to be disproportionately hit by issues such as climate exigencies, then while we are creating knowledge, we are creating policies, we are creating action plans, we must be doing it in a way that are participatory, because sometimes one of the things with marginality is that we also have we have defined who's marginal, and there is possibilities that a whole range of communities don't even become visible as marginalized communities, right? So I think therefore, I mean, I'm going to emphasize on in integration of bringing mental health alongside talking about climate justice issues, climate change, mediation efforts. I think that integration is important, but how do we conceptualize it? How do we do this research? How do we get to this understanding and knowledge? And then how do we do policy and action? I think that would be significant. So.
Absolutely, the community's participation is key. And on similar lines, UNDP has been working with NIMHANS and TIS as part of COVID response to build capacities of civil society organizations and community cadres. Currently, we are working with NIMHANS on developing holistic psychosocial well-being modules for the LGBTQI communities under the guidance of Ministry of Health and Family Welfare. I would now like to ask Mr. Pirwani that how do you think health and pharma sector can contribute towards addressing mental health issues arising due to climate change?
Hi, thanks for giving us the opportunity to talk about this specific subject. We all first have to understand certain facts and figures around the climate change and how it is posing the impact on mental health, which is already a big issue. If we look into WHO data, it clearly states that more than 75% of people living with mental illness live in a low and middle income countries. And these are those countries where climate change impact is also posing a risk, either in the form of the rapid change in economic scenario, the way people are living their life. It is impacting soil degradation, typhoons, cyclones, or in any way, it's really posing a threat. And after all these calamities or the issues which are happening over there, we also observe that relevant risks are getting converged into issues, health issues, and mental issue is one of them, which create a trauma, or we call it eco-anxiety, whatever we have heard in the past. And in these low and middle income countries, they do not have ability and capability to spend, and they do not have an access to medication. And that's where the pharma role come in picture, where pharmaceutical industries have enormous potential to reach out to this low and middle income countries to spread the access of medication around the 4 specific mental disorder issues, which we call it psychotic disorders, depressions, bipolar depressive disorders, and anxiety disorders. So medication is still something which is getting advanced, but it is available. It's just that what we need to do is to make sure that we increase the access. And that's where all top pharmaceutical companies in India and outside India are focusing on spreading their footprint in these low and middle income countries. And apart from that, there are 3 more agenda aspects which actually keep us on radar with respect to social in the ESG paradigm. One is implementing initiative to increase access to mental health product in such a manner that it is affordable also. It's not only availability, affordability is also a very important aspect, where every pharmaceutical industry has to play a major role to make sure that in bottom of the pyramid, people who can't afford the medication also should be able to access this type of a medication. Second, get into the partnership to reduce stigma and build local awareness to help manage these diseases and enhance the capability and capacity of health workers, and at the same time educate people in the community, make them aware what exactly is this issue. They can't keep these things up to them. They have to open up, talk about it. More they talk, they will find the solution also around it. And finally, when we talk about awareness issues, mental health problems, sometimes people feel that if I talk about it, people will consider me as someone who is not strong enough in the society to survive and find the solution for themselves. So this type of stigma also we need to break. And for that, we have to enhance availability, accessibility, enhance the infrastructure, and also make sure that people who are around us are able to accept the reality and also give them space, so that all those people who are going through this change are able to come out and speak aloud. I can give you some of the case studies of few of my friends who are there in US and California. Because of the forest fire, recently they have gone through it. A couple of my colleagues from the professional background who are in Australia recently gone through the flooding, which they have never seen in past. But because of the climate change, sudden change are really, really shaking them. Whenever I speak to them, they say that it gives them a nightmare. They get up on the bed in the midnight and they feel like they are burning or there is a water around them. So these all are clearly indication of eco-anxiety and things which are really making nervous. And this is just a beginning, because climate change impact is already there at our doorstep. So when we are part of the problem, we have to also be the part of solution. The pharmaceutical industry has been seen from the lens of giving the solution when the problem is already occurred. But at the same time, we also play a significant role to work on the upstream side of the climate change. It means whatever footprint we have because of our operation, how we can make sure that we minimize so that climate change impact also come down. So there has to be 2-level action which we need to put in place when it comes to climate change. One is on the upstream to reduce the climate change impact by reducing the carbon emission and also other impacts because of the globalization. Second, on the downstream side, being a pharmaceutical, make sure our drug is affordable, it is accessible, and we get into the collaboration to find the right research, right data, which will actually help us find new products, which will be more relevant to the issues which are there in place. So this is how the pharmaceutical industry can really help community, society, and by and large the world.
Yes, absolutely. In availability, in affordability, and accessibility. That's true. That's where pharma has a big role to play. Dear guests and audience, Ms. Manashi Chiller has some other engagements and would have to leave the discussion for today. But before Manashi, you move out, I'd like to quickly ask you, since you are juggling so many roles and you have so many responsibilities to take care of and also be an icon for so many across the country. How is it that we, maybe quickly, in 2 sentences, how is it that you keep yourself mentally fit? If we could take some tips from you. Thank you.
I think if I were to quickly sum it up, I'd say having a routine. And that's something which I've really learned the importance of, especially in college. I was only in college for a year and a half. But having a routine which includes good sleep, time to do something that, time to have a hobby. I was in a medical college, MBBS is not easy. You're running around the entire day. But kind of having a good timetable, waking up at a particular time, taking time to work out, taking time for your studies or whatever you do. And that's something which I think college taught me, and that's something which I've been able to maintain till today. Also, what I do today is very chaotic. I'm not doing the same thing every day. Some days I'm busier than usual. So having a routine and consciously making an effort really, really helps me. I also live with my family, which is great. I think they're a great support. When I moved to Bombay, they took the decision of moving here for me. So I think small things that you're able to do, having that time to shut out from the madness of your work life and doing other things like spending time with friends, having a hobby which is your time. It's the time when I get to spend with myself. Being able to take time out and actually, certain people. It is a privilege to be able to take a holiday as well today. But I think I consider myself lucky that I've gotten to do that. So small things, I think. But if I were to sum up three, actually, I'll sum up three really good practices that I feel help. I feel that for my mental well-being, physical exercise, any form of physical exercise is really helpful, whether it's taking a walk, working out, dancing, anything of that sort. I think spending quality time with loved ones is a great one, and having a routine. At the end of the day, you have to have a routine, irrespective of whether you're working, you're not working. And I think that's really helped me get through even the 2 lockdowns that we've had.
Absolutely. It is the small things that make a big difference. Thank you so much, Manishi. Thank you so much for joining us and sharing your thoughts and insights on mental health and how we can create a healthy planet. Thank you so much, Manishi.
Thank you for having me. And it was lovely listening to everyone speak. Thank you.
Wonderful. Thank you. So I would now ask Dr. Jaykumar that how important do you think are natural spaces, especially in urban areas? As Manushi was also saying, that exercising or maybe just a walk in the park, being around nature helps her de-stress and manage her mental well-being. So how important is having natural spaces to ensure our mental health and well-being? Dr. Jaykumar, I think your microphone is muted. Yes.
Yeah. I have two ways of looking at it. One, we need nature in our surroundings. We need trees in the streets. We need plants in the gardens. We need flowers in our balcony. We need nature in our neighborhood. So that is actually the natural spaces which we require in an urban, this one, as others mentioned. But along with this, when it comes to mental health, of course, there is going to be lifestyle issues which is emanating due to this climate change. The lifestyle change, the induced stress, also not only actually on the people's life, it is actually also the inability to balance the work-life balance, the social life, or even actually it actually even goes into the cultural and the other spaces. So here actually that we need to set up not only the green resources, we also actually integrate the psychosocial component into policies, plans of any urban uh, programs and plans and capacity building or even legislation. We need to bring in actually not only for the health sector, it should be actually sort of a multi-sectoral focused coming from every others. In climate change, there is no particular organization or particular department which is actually going to be a nodal, because all of us are actually stakeholders right across, from the school to the families to the communities to the government to the non-government, to every one of us actually have. So important is that integration at the multi-dimensional, multi-sectoral level is actually important. And added to that, looking at the specific populations, looking at the infrastructure, like somebody was talking about the affordability, accessibility, and the availability. So these need to be made sure actually at the urban, not only in the health centers. We need to actually cut across actually to every spaces which is possible. So let us not only look at the greens, let us also look at the green inside, not only the external, so that actually that we can spread this green not only on the environment, it is also actually on the people's emotions, people's life also.
Absolutely. I agree with you. You know, I have observed that so many times my mood is determined by if it is raining outside or if it's sunny outside, or I started my day with a walk in the park. So it totally makes or breaks my day. So, now moving to you, Dr. Anil Kumar, we saw that the Honorable Prime Minister gave the mantra of lifestyle for environment or life during the recent climate COP in Glasgow. So, how do you think movements like these towards sustainable lifestyles can help achieve our health outcomes, especially for mental health?
I think it's very important what our Honorable Prime Minister said. And if we keep that in mind, and if we bring this in our, if this bring change in our behavior, it can make a lot of changes. Now, what he said that instead of mindful, so what we need to do is mindful, deliberate utilization of resources rather than mindless, destructive consumption. But this is very, very important that we need to understand. Just to give you an example, see, every day in the morning I go for a walk or cycling. Now, every day when I go out, before going, I check whether what is the level of pollution outside, and if it is bad, I do not go outside. So that is something preventing me from going outside. Manusi was talking about the regular exercises, so that is something preventing me this pollution. So what we can do, what is suggested by our Honorable Prime Minister, that we should be using the deliberate and mindful consumption of resources. So what he's saying, that when we are talking about using the, say for example, our car or two-wheeler, whether we really need to use these vehicles, or we can just use the cycle to save petrol. That is what probably our Prime Minister was referring to. And then whether we can be vegetarian instead of non-vegetarian. Of course, we can be non-vegetarian to some extent, but whether we can change our diet so that we consume more of the vegetable diet. So these are something, and these small change in our behavior, we can make a lot of change. All those resources can be utilized properly. We can protect our environment, and that is how we can. He was talking about bringing these changes everywhere, in housing, in fisheries. He was talking about wellness. He was talking about hospitality. He was talking about the agriculture. So if we can make necessary changes in all those areas, we can generate a lot of employment, and that will ultimately lead to better economic status of the people of our country and everywhere in the world, and that will reduce the conflict which we have with the environment, with the society, and ultimately that will reduce. And we know the global warming, we know the pollution, all this have impact on our mental health. We are more likely to have anxiety, we are more likely to have stress, and depression. So all those things. So that scenario can be improved if we move forward what our Honorable Prime Minister said. And not only that, ultimately, if we continue, if everybody in the world move in that direction, probably we can, reverse whatever we have done in the past. We can reverse the impact of all those things. So this is my understanding of what Mr. said.
Absolutely. It's never too late to take up a good initiative and move towards a cause. So, Dr. Ranade, looking from a gender standpoint, we know that women are more vulnerable to the effects of climate change, including mental health and well being, especially as it can widen the social and economic inequalities. So, how do you think we can address this aspect? If you could explain briefly.
Right. So, I think take a step back from that question. And when we say women are more vulnerable, why are women more vulnerable, right? And there are structural reasons, there are attitudinal reasons, right? And I'm just tempted to talk about the UNDP, the Gender Social Norms Index, I think that you have developed, which has data across 75 countries, almost 80% of population in the world. And we are nowhere close to, on some perception level, we think we are quite close to gender equality. And that's the thing with gender equality. It's like a dance of 2 steps forward, 10 steps backwards, right? So if you look at this, the Gender Social Norms Index, and this is data of almost 80% of the world, right? 75 countries. And what we are seeing is that both men and women, more than almost close to 50%, men and women believe that men make better politicians, men make better business executives. Almost 25% of people in this data tell us that domestic violence is justified. We saw similar stuff happening last year when the National Family Health NFHS data was published. You may remember media had a field day talking about percentage of people across states who justify domestic violence. And there are these 7-8 reasons that are given, when is it justified for a husband to beat his wife? And at the top, of course, was that when she insults or is disrespectful of in-laws, and so on and so forth, right? These are sort of serious attitudinal issues, which also attitudinal issues contribute to structural issues in terms of whether it is, equal work for equal pay, equal pay for equal work, and a range of things like that. So I think when we are talking about women being vulnerable, it's to say that climate change is like that threat amplifier. That we have already established an understanding that women tend to be more at risk and more vulnerable for certain kinds of mental health problems, particularly what are called as internalizing disorders, where basically internalizing disorders are things like depression, anxiety, and so on, where the person suffering believes that it is their problem because of which things are going wrong in their life. So they internalize what's going wrong in their life, and they tend to then suffer from depression, anxiety, psychosomatic issues, and so on and so forth, right? In some ways we are saying that there is already a link between being a woman and then being a woman from a rural area, being a woman from a marginalized community, caste, religious background, not educated. All of this puts you more at risk for mental health problems. And in that sense, climate then becomes another threat amplifier, because if you are somebody who is in that sense last in the line for resources or for even informational resources. We know there's a lot of work done again within the disaster emergency paradigm that we heard earlier about women tend to know so little about what is going to, so if a disaster is going to strike, when information about this is being sent out, we heard quite a lot of interesting government initiatives on IEC and community level work and involving youth and all of these groups. Women tend to be the last to both have information as well as then access relief and so on. So I think understanding these vulnerabilities might help us. Again, I am constantly saying conversions and participation are two very, very key features if we want to really address some of this effectively. And you've asked me about women, but I'm going to, I cannot stop just by talking about, when I'm saying women, I mean cis women here. That is women who were assigned gender female at birth, who are comfortable living as a woman, and therefore cis women, but we also know that there are trans women who are even, I mean, as a minority community, they are even further invisible. We are now beginning to see changes with a new law, more welfare schemes that are coming out from the government happening in every state and so on. So again, just to say that there are many minorities and marginalized communities that may not even be visible to us. So when we use the term women, we often refer to one kind of woman, but there are other women that we don't necessarily think about. So just to highlight some of them. Yeah.
Absolutely. Thank you for your response, Dr. Ranade. So I would now turn to Mr. Firwani, and could you please tell us, Mr. Firwani, about some of the initiatives that Dr. Reddy's is taking to spread awareness on mental health and well-being and work towards this cause?
Absolutely. So our initiative is on our credo basis, which we believe that good health can't wait. It should start with our own family, which is our own employees. And we have like employee base of 22,000 employees working for our business in multi-continents, including India, which is the major territory where our employees work. And at the same time, the initiative around well-being, mental wellness is part of our Dr. Reddy's Foundation and health education, where we make sure that we take this initiative outside for many of the corporate hospitals where we have a tie-up, nurses, paramedic staff, physician assistants, postgrad doctors, physicians, and also key patients in those hospitals, how we can support them. So Dr. Reddy Health Education, the objective of this specific drive is to make sure that we handhold them in their patient journey. And at the same time, who are the caregivers, how we can also help them overcome of the stress issues. Because it's not only about, patients. If you see, the doctors are also under stress. And you have seen all caregivers in last 2.5 years gone through tremendous stress. I mean, the amount of pain which they've gone through. So this initiative actually is focusing those individuals also at the upper end who are giving care and people who are receiving the care. And our objective is that in next 5 years, we reach out to at least 2 million stakeholders where we can help them understand the issue well and also cope them with the stress and give them tools, techniques, method through which they can, make sure their well-being is taken care. The Within the Fence is very, very unique program. It's not something which we are going to give briefing to someone who is already going through the pain. That is more proactive. And in my introduction, you have spoke about My Health Index. So this is a program which we have started 2.5 years back, where we piloted it at 3 locations, and now we are scaling it up to 3 more locations. The objective of this program is to first evaluate the biochemical parameter of an employee, to tell them this is where you are, and then run certain surveys around stress and lifestyle, which says that where you will be. So it means that if your biochemical parameter is already screwed, it means you have to immediately act upon it. It can cause or pause or push you into the non-communicable disease paradigm. But if your stress level and lifestyle is also screwed, then you will be in deep red. Even if you are happy, healthy now, but if your stress levels are high, if your lifestyle is screwed, you will, over a period of time, get into a situation where you will suffer with many other elements, and the stress will cause some trauma over a period of time. Stress can be because of the work, stress can be because of the personal lifestyle or around you, if any of the reason. So this My Health Index program not only gives us the rating and says this is where your health index is, and now the choice is yours, but it is a next step ahead where we make sure that a dietitian, a physiotherapist, and a happiness coach is stationed at our site. And we make sure that we give the health passport to each employee and say, this is what your traffic light health situation look like, red, amber, and green. So if anybody who fall under red category, we make sure that they carry their passport, go to the counselor and talk to them. So knowingly, we don't call them as a psychotherapeutic counseling, we call it as happiness counseling. So in that happiness counseling, we give them an opportunity in case if they have issues related to their personal life or a professional life, they can even call their spouses, their children also in those counselings. And in past, we have seen employees bring their spouses also in the discussion to sort out the issues. And at the same time, their children's also, in terms of if there are certain issues and how we can give them help. So these type of proactive programs, where if we start taking into consideration at this stage, where average age of the organization is at 35 years of age, 5 year down the line, we will see the healthcare cost will come down, the productivity will go up, morale of the employees will go to the different tangent, and we will be able to build a strong nation, a healthy nation. Because our belief is that if the environment is healthy, if the people are healthy, then the society is healthy. The society is healthy, the community and the entire nation is healthy. And we are blessed with the young population right now. And everyone is want to be like on the top and try to be the better and then best. This is the stage where we have to give them a proactive direction or the right direction in terms of take care of your own health. So I'll talk about myself. I'm the best example of this. Like 2 years back, I was like 95 kgs weight, lot many issues, tremendous amount of stress. When I enrolled myself for this program, My Health Index, I've turned around my life. Like I lost 22 kgs in last 2 years. Every morning I go for a run, at least 12 kilometers. I make sure that I give this input to everyone that how they can turn around their own health. And the ripple effect of this is that in my entire family, everybody is health conscious. My wife is a now international yoga instructor. I'm proud of her that she is also now enlightening other people's life around. So let's understand that it's a movement which we need to bring in our country, where if we are able to create health ambassadors in and around our society, each and every ambassador will act like a lighthouse. People will look up to them and they can create a ripple effect around them. And even if they are able to change 3 people, these 3 will change 3 more. And that's how it will be a chain. There will be a movement. And this is the right time where we have to really step into and bring the change around us. And that's what is our job at Dr. Reddy's. And there are many more other programs where we run online, offline to make sure that we live up to our credo, good health can't wait.
Absolutely. We're happy to know about all the holistic initiatives that you and your organization are taking. More strength to you. Especially, it was heartening to know of your personal journey and story. We tend to totally emulate others around us, and creating a movement like that, it's important. It indeed was a very insightful and enriching discussion. And as we all know, friends, that climate crisis, as we have discussed during this discussion, is also a health and well-being crisis. Creating an enabling environment to ensure mental health and well-being for all requires a multi-pronged approach, and we learned today that how it can be done. It requires responsive health systems, it requires social awareness and reforms, and encouraging health-seeking behavior among individuals on the other end as well. But it equally requires living in tandem with the nature, preserving the earth to preserve our own health. On this note, I would like to thank all our esteemed panelists for today, Dr. Anil Kumar, Dr. Jay Kumar, Mr. Thakur Ferwani, Dr. Ketuki, and Manashi as well. Thank you for taking out time to share your experiences and your views on this important theme. And I would like to thank all of you, all our audience, for listening to us. And I'm sure that all of you and all of us will take that one green step at a time to make sure that together we can create healthy systems, healthy ecosystems for a healthy mind. Thank you for joining us all, and wish you all a very happy World Health Day.
Thank you.
Thank you. Bye-bye.